Anterior nasal packing is required when the external pressure or cauterization fail to control anterior bleeding, and some clinicians elect to use anterior nasal packing as a first line of approach. Anyway, the goal is to place an intranasal device that applies constant local pressure to the nasal septum. So, the commonly used one is a conventional ribbon gauze, where you immerse this or impregnate this with the ointment and put into the nasal cavity, and it can be either an horizontal method or this can be a vertical method of anterior nasal packing. And another which the commonly used one is Merocel nasal tampon, that is Merocel anterior nasal packing, this one. And there are so many variety with this is 8 centimeter with a string is attached, and in some cases you can also see the anterior nasal pack, Merocel nasal pack, with an inside there will be an tubing or a hole for respiration also or breathing also. And this is made of polyvinyl acetate, which is a compressed form polymer. This is inserted into the nose, and after insertion you can either inject normal saline into this, or towards the open end you can put some 10 to 15 drops of normal saline, or even you can use decongestant nasal drops, so that this will swell and this will fill the nasal cavity, and this will apply pressure over the bleeding point. This also aggregates the clotting factors to reach a critical level, thereby promoting coagulation. 2 or 3 companies are marketing this in India. Mainly one is an Medtronic, and another one is Evalon, and also Merocel, marketed by Medored. The actual insertion of this will take only a couple of seconds, and this a compressed and dehydrated sponge composed of hydroxylated polyvinyl acetate, as I already told. This can increase in size within the nasal cavity, and this has to be removed within 24 to 48 hours. Because it is a non-absorbable solid, this can cause pain and bleeding upon removal, and also mucosal edema can be present. It can also cause mucosal edema. In order to avoid undue pain, it is better to hydrate this with the normal saline or nasal drops at the time of removal also.